Hi, I'm Gail, Tyler's godmother. Barb chose me to be his godmother when he was born. It was the highlight of my life. He was a great kid growing up, perfect kid, of course. Of course he was. And he was just the apple of my eye. Tyler's very athletic. Golf is his forte. He's definitely awesome at golf. He was an Eagle Scout. He did a whole life of Boy Scouts ever since I can remember. Tyler's a trooper. He's a fighter. He's a great kid. He loves everybody. He's very sincere, compassionate, and his upbringing has just been awesome. He's got great parents, and I've brought him up to be a well-rounded young man.
When the cars impacted at the intersection, where they landed was something like 150 feet to 200 feet away from where the crash hit. The white van that hit the golf team van was on top of Tyler. The only thing that was exposed was his head and the tops of his shoulders. And the vehicle, the white van, caught on fire.
He was not responsive. He'd been unconscious first, then semi-purposeful at the scene. In other words, he would make movements, but they didn't make any sense. They weren't in response to what would be an appropriate action given the stimulus he had received. Brain injuries occur in motor vehicle accidents in a variety of ways. One is when a penetrating object goes through the skull and damages the brain. And the other is when the brain is jostled around inside the skull. Tyler had one of those jostling type brain injuries. And, he had a contusion or bruise of the left occipital pole of the brain, the left posterior pole. So that was one of those where the skull is slammed, the brain is displaced within it, sloshes around, sort of like jello in a bowl if you shake it, and then becomes injured, banging itself against the bone inside. The bleeding over the left surface of the brain, that would be the left occipital lobe from this bruise. Just like you would have blood under a bruise if someone hit you with a baseball bat real hard in the arm or something like that, damaged tissue that made it bleed.
We are looking at a head CT from the original date of the injury. It is dated April 29th, 2013. These images are performed on a CT scan machine. And so we're starting from the bottom, near the foramen magnum, near the base of the skull, and coming superior towards the top of the head. And the findings are fairly subtle on this first examination. But as we get to the top of the brain, we can start to see these white spots here in the left occipital region, the parietal occipital lobe, high up on the convexity. These are small spots of blood. Here's another one in the right frontal cortex. And those are what are called hemorrhagic contusions. Those are small spots of blood that indicate damage to the underlying brain tissue. They're generally caused by the brain being rattled around inside the hard skull. Neurosurgeons describe the brain as being the consistency of soft vanilla ice cream, and it does not tolerate those sorts of acceleration and deceleration injuries well. And these small petechial hemorrhages are indicative of what's called axonal shear injuries, and that's actually shearing of the brain cells and damaging the underlying brain. These are, in their own way, more devastating than the large bleeds that you may have heard about, epidural or subdural hemorrhages that form on the outside of the brain and cause their damage by pressure. Those can be evacuated surgically, relieving the pressure on the brain, where there's no surgical treatment for this. The treatment revolves around keeping the pressure inside the skull as low as possible by medical means. And this is the same examination. It's a CT of the head without contrast, again performed axially, meaning crosswise across the axis of the body. And this just shows the maturation of the injuries that he had. If you go up one more, you can see that the white spot in the frontal area is now larger. There is some low density around it. That's the edema, the swelling, in the surrounding brain, and it just reflects the maturation of these injuries. There hasn't been a new injury, they just mature, and subsequent scans over time show you a little bit more accurately the extent of the damage to the brain. This is in the right frontal cortex. The frontal cortex is responsible for the higher thought functions, and the consequences of damaging the underlying brain there is significant just in terms of higher levels of cognition. If you come superior, we can see the same thing, more of the right frontal damage, and then the left parieto-occipital, if you keep going, also have matured, are just a little bit more obvious and a little bit larger.
With a severe brain trauma, what we try and do, especially the type that Tyler had, where the brain is jostled, it doesn't have a blood clot in it that needs to be removed, like can happen sometimes. There's not a penetrating object that's gone in there that we have to take out, like a bullet or a piece of metal. But it's just been shaken up, and in that case it's going to swell, just like when you twist your ankle and then tomorrow morning it's twice as big. We want to prevent it from becoming twice as big because the brain lives in the skull, and the skull has confines, and if the brain becomes twice its size, it's going to pressurize itself in there, just like pumping more air into your tire. The pressure goes up, and if the pressure gets stronger than the pressure with which the heart can push blood to the brain dies. So in Tyler's case, we put an intracranial pressure monitor in, and worked by doing things like assisting ventilation, blood osmolality, to keep the pressures under 20.
Tyler? Tyler? This is Ashley. Hey buddy, you remember how sometimes you can kind of help yourself settle down a little bit? I want you to do that just right now.
Pathetic storm, an injured person. We all know that when we get excited, our blood pressure goes up, our pulse rushes, and we feel anxious. But that's in response to an appropriate stimulus. In an injured person, that can occur without any stimulus. And those can cause stress to the body.
These hemorrhagic contusions, we know, can be devastating in the long term. People that have these frequently do not regain consciousness from their injury. And the fact that he has injury throughout the left cerebral hemisphere and in the right frontal lobe, the fact that it's bilateral, just tells you that a large proportion of the brain is involved. And prognosticating on how these people are going to do long term is very, very difficult based on imaging. But this indicates a significant brain injury.
You know, a person injured such as Tyler could run the spectrum from being, grossly retarded to seemingly normal, but with errors in judgment and planning, such that maybe he ran a small business, everybody thought he was the same guy, but now he goes broke. Those fine things that we don't see unless you do cognitive testing to bring them out. So, I've seen all sorts of varieties of recoveries from head injuries like this, and I haven't seen him since he left, so I don't know what his was, but all the way from somebody who you would think may have been a great student, but now seems like a very retarded, mentally deficient person, to someone who you think is just like yourself, but yet if you hired them and they were trained as an attorney, they would be a disaster, and you wouldn't know it till you got involved in their abstract thinking and this sort of thing.